link between red meat and cancer. That's another one that people are terrified about.
Well, I think for good reason. I mean, I think cancer is something we want to avoid. I mean, and the one that, red meat has most closely been linked to colorectal cancer on some epidemiologic studies. In fact, the World Health Organization in 2015 declared unprocessed red meat a type 2 carcinogen. Now, behind that story is that the relative risk or the absolute risk of red meat and cancer increases your absolute risk by about 1%. So it's a very small amount. Okay, so 1% in those that eat red meat versus those that don't eat meat, based on the World Health Organization data. Now, people that were on that committee, like I'm blanking on his name right. I'll think David Clearfield. Professor David Clearfield was on that committee, and he basically said that they literally ignored all the data that said red meat does not cause cancer. They threw out all the studies. They didn't consider those. About 30% of the participants on that trial were vegan or vegetarian, so they had a sort of an ethical a bias there, which they failed to declare. Now, there have been a number of subsequent studies since 2015. There was a huge study in 2019, the largest review ever done on red meat, and several papers came out of that, all suggesting that there is little to no evidence whatsoever that shows that red meat is a carcinogen. But when we look at our risk for cancer, if we say red meat causes a 1% absolute risk, so if you had a 4% chance of developing colon cancer, now you have a 5%, so 1% risk, which is about a 17% relative risk increase. Let's compare it to other things that are associated with cancer. Obesity carries something like 150% increase risk, some maybe as high as 300%, particularly if it's central obesity. Now we're talking 400% risk. Diabetes increases your risk by cancer for maybe 200%. When we're looking at chronic inflammation, we see another 150, 200% increase. Things particularly which carnivore diet seem to help extremely well with are things like inflammatory bowel disease, ulcerative colitis, and Crohn's disease. That increases your risk for cancer about 3,000%. So when we put all these things together and say you on a carnivore diet, you lose weight, your obesity gets better, your central obesity gets better, your blood glucose improves, your inflammation improves, which all pretty reliably happen, your risk for cancer actually has gone down significantly, much more significantly, and it way overshadows the small 1% absolute risk that the World Health Organization posited, even though many other organizations now disagree with that. So I don't think it is a factor. I think the biggest factor for colorectal cancer, again, is the modern standard diet, which is just complete, garbage, ultra-processed food everywhere. 60% of the U.S. diet is ultra-processed food, and I'm not sure. Where are you calling from, by the way?
I'm calling from Mexico at the moment, but I'm from the UK, and I was just about to say it's very similar in the UK. Very similar.
Yeah, right. It's very similar in the UK, and so, I think if we focus on those things and the bigger picture risk factors, the same thing with cardiovascular disease, we can make the same argument there. We can see that, the average American, for instance, eats about 2 ounces of red meat a day, or 2 ounces of beef, I should be more specific. That's a tiny, tiny amount. And 60% of our calories are coming from ultra-processed food. And just from a common sense standpoint, you would say the stuff that we're eating the most of, which we hadn't eaten. Beef consumption in the United States has gone down tremendously. It used to be almost close to twice that 50 years ago. We used to eat twice as much red meat. Now we're eating close to half that. And diabetes, obesity, chronic inflammation, autoimmune diseases, mental health disease, all have gone up significantly since that time. It's not, you can't, infer directly, but it makes it hard to make the case that red meat is responsible for this when we've been eating less of it and these conditions are getting more prevalent.